The hopeful mind would conclude that we might be less vulnerable to COVID-19 than previously thought. But would that be a step too far?
Oh, I don't know, Andrea. What they definitely have shown, though, is that the community transmission, i.e. the numbers of people in the community who haven't been hospitalised with COVID-19, is higher than was first thought, and the fact they haven't gone to hospital is quite cheery, I suppose. The figures are quite varied as well, because in London, a cosmopolitan, very busy city with a lot of people using public transport, the figures were 13%, whereas in the rural areas, southwest of England, it was only 3%. And one of the other really interesting facts that came out, not that surprising perhaps, was yet again proof that those from the Black, Asian, minority ethnic communities were much more impacted by the virus. The figures for the black population was 17%, the white population 5%, and the Asian population 12%. And another figure that was interesting was that younger people were twice as likely to be infected as older people. So this is the 18 to 25-year-olds, twice as likely, it's about 8% compared to those over the age of 65. Of course, that might have been because the elderly were shielding, because they had underlying health conditions, or they might have just been keeping themselves socially isolated. So yeah, quite startling figures, definitely.
Right. And also that other study you were alluding to there about not just the teens, 18 to 25, but the children, far less likely to contract COVID-19 on whole.
Yeah, now this is a completely separate study that was also published today in the Archives of Childhood Diseases. And this showed that, I think it was a study of 500,000 people, hospitalised and community transmission with COVID-19. And those who were tested positive were children. So really, really tiny, tiny numbers. Now, obviously, this doesn't tell you whether they infect other people. It doesn't show anything about the rates of transmission of disease by children. But what it does show you is that they definitely don't seem to be impacted. And the ones who were infected more than the others were the older children, the teenagers.
Okay, Nicola, thank you so much for that. As always, from London.